This is Assemblywoman Petrie-Norris. Thank you so much for joining us for tonight's Facebook Live Town Hall. We'll be talking about the efforts that are underway to ramp up testing for COVID-19 all across Orange County. As most of our viewers know, testing has been a major challenge as we have confronted the global pandemic of COVID-19. It's been a big challenge for our country, for our state, and for our county. And we've gotten a lot of questions in the office about where can I get tested? How much testing do we need to have in order to reopen the economy? And what are the next steps to actually make that happen for Orange County? So we are glad for the opportunity tonight to be able to answer some of those questions. And I'm really grateful to be joined by three terrific panelists who will help us do just that. So tonight we are joined by Dr. Ed Monuki from UCI, and we are also joined by Tab Tuchinda and Karen Hamlin, who are joining us from Quest. So thank you all for being here, and would love to give you a moment before we get started, please, to introduce yourselves and share with our viewers some of what you are doing in the COVID-19 testing space. Dr. Monuki, let's go ahead and start with you.
Well, thank you so much for having me. It's really a pleasure to be here. So I'm Ed Monuki. I am the chair of the Department of Pathology and Laboratory Medicine at UCI. And as part of that role, I oversee the clinical laboratories that is responsible for the testing for COVID-19. And some of the sort of the bigger projects that the testing wraps around as part of the UCI health system are the reopening of the hospital. You know, a lot of patients have been delaying their care because of the coronavirus outbreak. And so facilitating the reopening of the hospital, helping some of our community partners, first responders, and those sorts of things who need some of it, particularly some of the skilled nursing facilities now. Basically continually thinking about how we can facilitate more testing so we can really help more of the city of Irvine and all of Orange County help to reopen and get back to work and still control this disease.
Well, thank you. And from Quest, we've got Tab Tuchinda. Thank you for being here as well. I think you're on mute, or we can't hear you.
I'm sorry about that.
No problem.
Oh, well, thank you everyone so much for having me at this town hall tonight. So my name is Dr. Tab Tuchinda. I am the medical director for the West Hills Lab in Los Angeles for Quest Diagnostics. We have a number of labs in California, in Southern California, not just in Los Angeles, but also in San Juan Capistrano in Valencia, California. And we perform a lot of the COVID testing, both the serology and PCR testing for COVID for the state. So much of my work currently is to try to expand the capacity for testing and try to make access easier for patients to get testing done.
Great, thank you. And Karen Hamlin is also joining us for Quest. Thank you for being here.
Thank you so much. I am Karen Hamlin. I'm the Executive Sales Director for Quest Diagnostics. And it's really my job to act as a liaison for clinicians and patients so that they can have easy access to the laboratory and ensure that there is ample space for them at our patient service centers to get testing when that's needed. And I'm excited tonight to come on and speak with you and with your constituents here in Orange County. Thank you so much.
Well, great. Thank you. So let's jump into the questions. And Dr. Tuchinda, as you mentioned, there are actually a couple of different types of testing. There's the diagnostic PCR testing and serology and antibody testing. I think to start, let's just start about the diagnostic PCR tests. And that is essentially the test that people take to see if they are currently infected with COVID-19. So Dr. Monuki, I'd like to start with you. Monuki, I'd like to start with you. So who should be tested for COVID-19? And I know this has changed in over the course of the last couple of months. So right now, who should get tested?
Well, right now, the CDC guidance, which as you mentioned, changes on a pretty frequent basis. right now the priority are for some key individuals who are symptomatic, who have symptoms, in particularly people who are in the hospital, first responders, healthcare workers who are symptomatic, people who live in crowded living facilities or congregated living facilities, like in nursing homes and those sorts of things. Those are considered very high priority. And then the CDC has sort of guidance on a second tier of patients that they call priority patients. Those include individuals who have symptoms that could be COVID-19 and that we want to get tested. And then increasingly, especially for the health departments, to be able to increase the access to asymptomatic people. So people who don't have symptoms, but that the health departments think are important to be tested. So that's the current guidance from the CDC, and it is purposefully to have some flexibility at the local level to modify that to some extent.
And what are the key symptoms? So I think most folks know this by now, that it's fever, cough, but recently the CDC guidelines have actually added some other symptoms that can be a little bit more rare, but can still be a sign.
That's right. There are a few other symptoms that may be a little bit unusual for some. There is a preceding kind of GI, so gastrointestinal, stomach, diarrhea, those things maybe before some of the symptoms of like the cough, shortness of breath came on. There's some additional symptoms just kind of related to just not having enough oxygen, so problems breathing, that sometimes even just things like having sleeping a little bit more, can be a sign that you're not getting enough oxygen, might be a subtle sign. Seems like some of the other recent things, some problems with blood clotting. And so if there are some things, there's something interesting called COVID toes, for example, that might be little blood clots in people's toes to be aware of. So some symptoms like that seem to be a little bit unusual and specific to COVID-19.
And I think, the urging that I've had from our county public health officials is that folks should call their healthcare provider. So if they've got questions or concerns, even if you're asymptomatic, call your healthcare provider. And right now, as we're all sheltering in place and becoming Zoom experts, there are an abundance of telehealth resources available so that you can get on a call like this with your doctor actually in a pretty short order. So over to Dr. Chuchinda or to Ms. Hamlin. So where can I get tested in Orange County?
Yeah, so we've talked about the two kinds of tests now that there are out in the market. So first, for active infection, molecular or PCR testing, this type of swab needs to be collected either at your physician's office, at a hospital, or at one of the local county clinics. This is not something that Quest Diagnostics phlebotomists can perform at our patient service centers.
Okay.
So you do need to go to a physician's office and have a clinician provide, again, the swab. The nasal or the oral swab cannot be performed at Quest and does need to be done at a physician's office. So for serology or blood testing, the antibody test, that can be performed at Quest Diagnostics or at your hospitals that have laboratory patient service centers. That is certainly something that is available across Orange County. We do have 17 patient service centers in Orange County, and we also have a stat laboratory, which is for our rapid response laboratory there in Orange County. So you have a lot of access there to get tested and for serology testing. And if you come into the service center and ask for an active infection test, we'll give you some clues and some hints of where to go for that.
And I would also add that you mentioned the Orange County testing network, and there's now 14 sites that are part of the Orange County COVID-19 testing network. And then there's also 4 state sites that the state of California has stood up actually just this week. And so those are also being rolled out. And folks listening at home, you can find out more information or make an appointment online, go to ochealthinfo.com/COVID test or call 800-564-8448. And I always find you can get to that if you just Google COVID-19 Orange County testing. It will take you there, and you can find the location for the Orange County COVID-19 testing network sites, as well as the 4 state sites. And in addition to the sites that are being run by the county public health department, we have sites all across the county at private laboratories, at doctors' offices, and hospitals as well.
If I might add just a little bit, I think also, and UCI is not the only one, but a lot of the Orange County hospitals do have drive-throughs and tents for getting those specimens, including the swabs for the PCR diagnostic testing. It does typically require an appointment, and UCI, and I'm sure the other hospitals, there's a triage line that you can call to make an appointment if you believe you need one.
Yes, thank you for pointing that out. And how long does it take to get test results?
So the demand is quite high, as you can imagine right now, especially for PCR active infection testing. So just like with all things, toilet paper or bread or meat, now there is a capacity limitations that laboratories face, and it's something that we're definitely working on. But as of today, we are following CDC guidelines for prioritization of testing. So we do have a prioritization that happens as specimens come into the laboratory. So priority 1 samples, which are for inpatient hospital or first responders. Right now our turnaround time is less than 24 hours. And for patients who are not in that P1 category, right now we are about 4 days for turnaround.
Okay, 4 days. And I think you mentioned that there's work underway to continue to grow capacity and then continue to compress those turnaround times. And I know that's happening here locally and all across the state. Okay, so next question: what should I do if I don't have a doctor? And as I mentioned before, if you do have a doctor, the best thing to do is contact your healthcare provider. Explain your symptoms. They'll be able to write you a prescription, connect you with a testing appointment. If you don't have a doctor, then you can access the Orange County testing network. So that's what I mentioned earlier. So go to ochealthinfo.com/COVID test, and you will be able to make an appointment online. Next question: how much does it cost to get tested? Is somebody want to take that?
I'm happy to talk about that from the UCI perspective. I think the good news is that all insurance is covering the cost of the test, so including Medicare and Medi-Cal, as well as private insurers. But I did ask my business partner to tell me what the current cost of tests was. So for the molecular diagnostic test at UCI, it's $65. And for the antibody test, and there's been some homogenization of that price with the rest of our UC system, that's $42.
Okay. But on the diagnostic COVID-19 test, it should cost private individuals $0, correct?
Exactly. I think insurance is covering the full cost of those tests.
Great. And if people don't have insurance and can't afford to pay for the test, the Orange County testing network that I mentioned earlier is providing tests free of charge. So not being able to afford the COVID-19 test should not be a barrier to anyone who wants to and needs to be tested. So another question around the, kind of who needs to get tested. I don't have any symptoms, but my husband just tested positive for COVID. Should I get tested? Dr. Monuki, can you take that one?
Yeah, certainly. So I think increasingly the answer is yes. And that falls into that CDC priority, especially even though somebody might not have symptoms themselves, if they have a high-risk contact, those are the people that really should be evaluated for a test. And that gets to the issue, I think, that we may touch on later, the idea of contact tracing. And so it has been for a while where the recommendation was not necessarily to test somebody like that, but increasingly, I think the idea is that those people should be the ones getting tested.
Right, and that's a reflection of, as you've all mentioned, the fact that we have been able to meet some of the supply challenges, and we have been able to ramp up testing so that we can expand into those other areas. And the other thing I want to add there, just again, is the non-doctor in the room, is if people do get tested, if you're living with someone who has COVID-19, a negative test result does not mean like just go about business as usual. If you are living with someone or you have close contact with someone who is positive, you should self-quarantine for 14 days. Now you're nodding your head, so is that correct?
I couldn't agree more.
Okay.
And I think it's because there's this issue, I think probably many of the listeners will be familiar with this idea of false negatives, that the PCR test will be negative, but they will actually have the disease and it was just undetected. And it's usually not because of the quality of the test. The Quest test and the ones that we run are actually very high quality, sensitive tests. It's just a challenge of the virus. It comes and goes. It's usually present in that first week of symptoms, but then it rapidly, the body typically clears it. We're only sampling typically the back of the nose or the back of the throat, just one site. And sometimes it's hard to get a good specimen from the back of the nose, which has been the preferred site for some time. So there's a lot of reasons for those false negatives. So you're exactly right. Just because you have a negative test, this idea is still to practice that isolation and the social distancing, good hand hygiene, and those sorts of things.
Right, all those basics. So Dr. Monuki, we talked a little bit about everything that's being done to ramp up testing in Orange County. Can you just kind of give us an overview of where are we now in terms of capacity, and from your vantage point, where do we need to be in order to safely reopen and start safely and responsibly moving through the phases of a reopening plan?
And so I'm happy to share sort of my thoughts and opinions on that. I think one of the interesting things is this is new for everybody, and everybody is kind of deciding a little bit on their own what is in their own best interest to do that. But I would say, we're at an interesting phase because at the beginning clearly we didn't have enough testing. Actually, I would give a shout out to Quest because in Orange County they were beyond the public health agency. They were the first one to really be able to provide testing for the citizens of Orange County. And then us at UCI came on as being the first hospital or hospital system to have that capacity. But, we were all caught a little bit behind. And we're in the state now where most of us actually have excess capacity for the testing. And as, so part of it is just loosening up the guidelines so more people that can get tested, that should get tested, and then kind of deciding in hopefully a rational way, who are the people that should get tested, so we can contain this, but get back to work and reopen the economy. And so I think we're in this interesting phase where we're continuing to build more and more capacity, and many of us have more capacity than we actually have test requests for.
Right. Okay.
And that we would like to fill that. And we're at the same time thinking about how we can increase testing more, because as we think about opening schools in the fall and opening lots of more businesses, we will increasingly need still more testing.
And so Quest, perhaps you can speak to kind of some of the challenges that we have had in ramping up testing, as I said, not just in Orange County, but all across the state and the country. And what are some of the things we've done to meet those challenges, and kind of where are we now in terms of supplies?
Sure, absolutely. I can answer that one. So, there are a number of things you have to have in place for a patient to get COVID testing. Not just the instrument to run the test, but in fact, you need the infrastructure in place and the folks who can actually collect the patients. You need the test kits that you can use to collect patients. You need the logistics infrastructure to transport samples to the lab. You need the folks in the lab to run the test. And then also importantly, you need the instruments and the reagents to run the tests themselves. And so anywhere along that timeline, you can have bottlenecks. And in fact, invariably, we've had supply bottlenecks at each of those points. We've had challenges with PPE for our phlebotomists. We've had challenges with test supply. And we've also had challenges with swabs and test kits. And so, you know, as Dr. Monuki mentioned, the supply chains have opened up significantly in the last few weeks, such that we have much more supply than we did initially. I think it's useful to kind of look back, you know, in mid-March when we first offered testing, which was just 2 months ago. You know, it certainly seems like a long time, but it was really only 2 months ago. You know, back then we were only offering a couple of thousand tests a day. Now at this point, I can only speak for Quest, but at this point, Quest is able to generate 50,000 test results per day. And as we bring on more capacity, which involves bringing on new instruments, validating additional tests, we believe we can increase our capacity up to 100,000 or more tests per day. And this is across the Quest network. And so what's really allowed us to increase capacity to such a large extent has been that, you know, a number of manufacturers have gotten FDA EUA authorization for their platforms. And so as we've seen an increasing array of different manufacturers' platforms come live, we've been able to incorporate them into our labs and bring up testing. And so, you know, at this point, we have testing across a number of different platforms, and that's gone a long way to improve our capacity. So we are seeing much improvement in supply, but certainly still some challenges.
Good, and I know I think that's reassuring for people to hear. I think that the reality is that this is moving incredibly quickly, and I just heard, I think in some of our test sites this week, the challenge turned out to be gowns. So for the first time, for so long, we've been focused on sourcing enough masks. When we talk about personal protective equipment, we didn't have enough of those swabs. And, you know, people made a joke of like, who could have imagined that like a giant Q-tip was going to be the big barrier in addressing this pandemic? And I know on the swabs, there's been some big breakthroughs, which have really moved us forward. And that's really exciting. But I did hear that, you know, gowns were in short supply in some of our facilities. So I think that, you know, increasingly we're moving in the right direction when it comes to supplies and personal protective equipment, but that is an area of continued concern statewide and continued focus. And we've got to ensure that we establish reliable supply lines, whether that's for testing or for the personal protective equipment that's required in our hospitals, in order for us to actually safely move into, into the next phase. So, and actually one other thing I wanted to point out that I didn't say earlier when we were talking about the expansion of testing sites is just yesterday, the governor announced that we would be enabling some pharmacists to actually start conducting COVID-19 tests using pharmacy sites. So as people know, you can go to your CVS and get the flu shot. There's a number of other tests that pharmacists are able to conduct. And I think that, you know, that's not happening tomorrow, but as that starts to happen, that is going to go such a long way, I think, to just improving accessibility and ease for folks all across the county. Let's see. Okay. All right. I've heard Orange County isn't doing as much COVID-19 testing as other counties. Is that true? Dr. Monuki, do you want to take a first pass at that?
I do have some thoughts about that. Okay. You know, certainly one of the dashboards I tend to look at on a daily basis is the Orange County dashboard, which I think reports the amount of testing being done at the public health agency as well as the commercial labs. What I don't know is if it's really comprehensive. I think it doesn't include the numbers being done, for example, at UCI or some of the other hospitals in the area. So I don't actually believe that the numbers that are easily accessible are really accounting for all the testing going on in Orange County. That is the one sense. We all have to report our testing numbers to some extent to various agencies, states, for us, the University of California, and FEMA. And so I don't know if those numbers get passed back down in a comprehensive, collated way to the counties. So my sense is it's an accounting problem.
Interesting. Okay. So we still need to get better data and do more to ensure that we're kind of getting the full picture. And then, because I had, unfortunately, our public health officer wasn't able to join us on this call tonight, but I did get the chance to bounce a few things off her before. And what she explained is that actually, yes, we have been doing less testing here in Orange County, and that is because our disease burden is lower. So that if you look at, there are some things that are hard to know, like the infection rate is hard to know, but we do know like the death rate. And when you compare our death rate to San Diego, to LA, it's actually like 1/5 of San Diego and 1/10 of LA. So we do have fewer cases per capita. Again, it's kind of, looking at rates. So you would expect us to have fewer people having symptoms, fewer people asking to be tested.
Right. So I think that's a great point. Everyone knows that we've undercounted how many cases are overall. Mm-hmm. So kind of, this is maybe a little bit geeky, but the idea that, the denominator is hard to get, but the numerator doesn't hide in terms of the death rate. And so if you kind of extrapolate from the numerator, it did seem like we didn't have as many cases necessarily as some of our neighboring counties.
Okay. And any perspective you would add from the Quest side, having working all across the state and the country? Do you have a perspective on that? Anything to add? Okay. All right.
Is exactly right. That the data, is key, and we're all searching for the right kind of data, but in its aggregate form, sometimes it's hard to get a hold of, and then to narrow it down to a specific zip code or a county can get tricky when we're not all doing the same type of reporting at the same time. Everything gets reported, and then it may take a while for it to get into a single spreadsheet that we can all take a look at. So I think you're exactly right that it's been a little challenging, but when you compare yourselves and when you do some benchmarking, I think Orange County is well ahead of the curve for testing, and you've done the right things as far as social distancing and stay at home, and so you're well into that curve.
And then I had another couple questions about sort of how much testing do we need to be doing. So the first is, so when and where will every Orange County resident have full access to COVID-19 testing like in LA County? So my understanding, and I would love you to add or correct that, is that is the case right now, that the Orange County testing network is there in order to ensure that everyone who needs to be tested, whether or not they have insurance, whether or not they have a healthcare provider, is able to be tested for free. And that is the same situation as we have in LA County. Is that correct?
So I can tell you that Quest recently has ramped up our collaboration in Orange County, and we're working with your task force there to ensure that the proper amount of testing is available to all of your residents. We are working very closely actually with the federally qualified health centers, the FQHCs like Ultimate, to ensure that testing is available and that there is enough kits and enough capacity. And we have, and like I said, that has been wrapping up for the last couple of weeks. So also, there are agencies out there, including Quest, that are offering direct-to-consumer testing. So that is available as well for patients who are concerned and maybe want to go outside of the regular physician's office to get testing. So that is available as well. So I do think that there is a want and a need from patients out there, and working with the County of Orange has been great, and we are happy to collaborate.
Okay, that's really, I think that's good to hear. Encouraging, really encouraging, I think, for me. Okay, and so how much testing do we need to be doing? And I think this was, I'm going to kind of answer this from like the statewide goals perspective, and then would love for you to add on to that. So Governor Newsom has set kind of two goals, not just for Orange County, but for communities all across the state. So he has set a statewide goal of 80,000 tests per day. And so that would be kind of Orange County's share is 6,400 tests per day. And my understanding is actually we check the box in terms of our ability to do that right now. And then the other goal that's been set, which is a little more geeky and a little harder to understand, is something called positivity rate. And so positivity rate means so I'm going to try to explain this, translate this into the way that I understand it, and you can make sure that I'm being scientifically sound. So positivity rate is the number of, is the number of positive cases divided by the total number of tests. So if you've got a positivity rate of 100%, meaning everybody you're testing does have COVID, that's pretty bad, because it means that symptoms are pretty extreme before you're testing, and you're obviously missing a lot of cases. Similarly, if you've got a positivity rate of 0.01%, like that's not a very good use of resources or time. So the statewide target that the governor and the California Department of Public Health have set is a positivity rate of 7%. And Orange County right now is actually slightly below that. So we're at 6.3%. And that's similar to San Diego. And then some of our neighbors are slightly above that, though approaching it. So San Bernardino is at 9% and LA is at 10%. So both of those communities have a little more work to do to kind of get to the state's target. But Orange County right now, we're actually on track for that metric as well. So again, learning that was really encouraging to me, and I hope is to the folks at home as well. Anything that you would add or build on from that?
I guess I would just add, I think that's a great point that you bring up, because we're all trying to find the right balance between testing too much, and which means that we're probably building too much capacity and wasting resources on those things in a direction that we could be using in other ways, versus testing too little. And so I think that's about spot on in terms of, if we're following the CDC guidance for really who needs testing, and we're basically hitting that mark. Your numbers are very well aligned with what we're seeing at UCI as well. And so I think that's a really, great point, that there is kind of a sweet spot that says that we're testing just about the right number to be able to manage and control the situation. So, thank you for making that point.
And then we've got kind of a related question from someone on Facebook. So can we be tested more than once, next week and then again a month later and monthly after that? If so, is that a good idea?
So maybe, and that's I guess my response to that would be a follow-up to the point you just made. I think there is, again, a sweet spot for how frequently one would want to test an individual as well. And again, clearly somebody who gets new symptoms within a month, and that they could be COVID for other reasons, they should get retested. But I think, I think the current thinking among the ones who are thinking about this in terms of just that question you asked, what's the right amount of testing? Do we need to be testing the same person over time if they're not in a high risk situation? I think that it's different if you're, for example, a resident in a nursing home. I think again, there's much higher risk in a situation like that, and other situations like that, where I think repeated regular testing and surveillance do make some sense, because you really want to nip those outbreaks in the bud as quickly as possible. But in the general public, I think it's really less clear whether frequent testing, repeated testing without new symptoms really makes sense or not. And that's one of the discussions we're having on our campus. Obviously, UCI is a very large campus. We're hoping to reopen to some extent in the fall and help people get back to normal. And those are exactly the kinds of discussions we're having. So probably some initial testing, but does it make sense to do repeated testing? I think it's less clear.
Well, and you mentioned that that guidance might be a little bit different for communities that are really vulnerable or really high risk, such as skilled nursing facilities. And we actually do have a couple of questions that are related to that. So the first is, are senior living facilities going to be mass tested? And related, my mom is in a nursing home. I'm really worried about the outbreaks we're seeing. What are we doing to make sure there's enough testing in our nursing homes?
Yeah. So that is a real hot a flashpoint right now, because that is the case, and for good reason. There's concern about that. I believe Governor Newsom came out with guidance, basically directing residents and staff to be regularly tested, and so we are actually working on multiple different fronts with Orange County Public Health to be able to help them with the testing for the skilled nursing facilities in Orange County. So that will be happening. It is a challenge because it is a bit of a crisis, if you will, at this point, and so that needs to be an area of focus in the short term.
Absolutely, and I think that that outbreaks spread like wildfire in those facilities and are every bit as dangerous. So the state is certainly prioritizing that and focusing resources on ensuring that we get that, as you said, that frankly crisis under control. And I think it was just yesterday or perhaps earlier this week, the governor did issue guidance to skilled nursing facilities all across the state to develop a mitigation plan that included regular testing. And the state's commitment and what we need to do to ensure that our counties and that our skilled nursing facilities can actually be successful is ensure a reliable supply of the personal protective equipment and the testing supplies to make that happen. And so that is in process, but it's a huge area of concern. Okay, so and actually one last kind of related to this subject. So how long, how long does it take from the time of infection until the disease is detectable by the swab tests that are currently available?
So, no, Dr.
Go ahead.
Well, so my understanding, and of course there's been a lot of information coming out on that, the average time to developing symptoms is about 5 days.
Okay.
After infection. Now there's a range, of course, anywhere from 2 to I think the latest I've seen was sort of 2 to 14 days. Kind of captures the vast majority of people. The average is about 5.
Okay.
Is my understanding.
Dr. Chichenda, anything you would add to that?
Yeah, I would certainly agree with that.
Okay.
What we've seen is that the average patient who becomes infected with COVID-19 takes 5 days before they show symptoms. Now, with respect to when they will test positive by PCR, generally they'll test positive once they show symptoms, but we have shown that patients can actually shed virus and test positive days before they show symptoms, 1 day, 2 day, or more. But generally, yeah, we don't recommend testing until a patient has shown symptoms.
Okay. Okay. All right. And then switching tack a little bit, but I think it's an important thing for us to talk about. So Governor Newsom has been talking about testing and tracing. What is tracing? And Dr. Monuki, can we start with you on that?
Sure. You know, this is in the realm of public health, and I'm no public health expert, but, you know, fortunately part of a campus that has a school of public health, and we think a lot about contact tracing. So it's really, you know, sort of the idea of supporting and identifying the patients who do get COVID-19 and trying to identify who else they had close contact with who might be at risk for also having COVID-19. It's a very specialized skill set, one that's typically done out of the public health agencies. You know, there's a lot of different issues with that. They're very careful about privacy concerns and those issues, as well as, you know, needing to be able to communicate the medical terms and the meanings of the tests and what they should be doing. So I kind of view it as a little bit of a social work support for the people who actually get the COVID-19 disease, and then trying to identify others who might be at risk of getting the disease. Very important, obviously, as we try to control these little.
Yeah. And the way that it's been described to me is a couple of things. First, it is a way for us to identify outbreaks early, so that we can keep a small outbreak from becoming a huge outbreak. And that what happens is, and this isn't actually anything new. So this is what our public health departments all across the country and, you know, all around the world do right now, you know, with some STDs, with TB, with measles outbreaks. And a nurse will reach out to somebody once they've tested positive and will ensure that they have what they need in order to self-isolate and to self-quarantine. And then they'll also reach out to their immediate contacts also, so to tell them, you've been exposed, you should quarantine. Do you have the resources you need to do that? And there was actually a quote, it was on the county public health website that I'm going to read, because this is how the nurse herself described it. She said, "My goal as a public health nurse is to care, support, and provide public health safety for our community. As a case and contact investigator, I'm able to assist, support, provide educational health resources to our community to increase public health safety." So Dr. Monuki, you described it as sort of almost a social worker for people who have had the illness, which I think is a good description. And we have a question about, you know, how many contact tracers are we going to have here in Orange County? The state goal is that the County of Orange have 400 contact tracers. We actually have 75 folks that are already doing this work right now. And we also have a couple hundred of people who are already cross-trained to do this and provide surge capacity. There's also the state launched a training academy, I think just a couple of weeks ago, which is going to enable us to close that gap. So we've got 75 folks who are doing this actively right now, but we're actually not that far away from being able to kind of, you know, hit that sort of surge workforce capacity of 400. And it seems to me like it's a little bit like, it's sort of like building the surge capacity in our hospital system. We've got to have it, you know, in case we need it, but we hope we never need 400 contact tracers here in Orange County.
That I would agree. It's very similar, building the capacity to do that. I think some public health officials wonder whether we actually need to build more than that to really be able to do that. I know, again, our Dean of the School of Public Health here, Dr. Bowden Albalas, you know, thinking about that a lot. and what we might need. But I think that's a great place to start. And I think it's fantastic that the state and the governor of Newsom are really, trying to do what they can to help us prepare for these.
Okay. And I think when people hear numbers like we're going to have, 400 contact tracers in Orange County, we're going to, have thousands across the state of California. I've had a lot of people who have said to me, gosh, that sounds really creepy. How is this actually going to work? And we talked a little bit about what people do. I don't know, does one of you want to field that and then I'll add on?
Well, I think it gets to like the privacy concerns and those sorts of things. Somebody's invading my privacy, maybe they're gonna, so, and that's where kind of the skill and the cultural awareness and the social and emotional intelligence of the contact tracers really comes into play, which is why it does require some training to get people who can do that appropriately and make people feel at ease about
and
that.
I think people have sort of this like almost like a sci-fi movie image of, it's like the I don't know, there was the Tom Cruise movie where everyone was being tracked, and I'm forgetting the name of it. People have that kind of image in their mind, and I think the reality is that at least in America, this is not, we're not using people's cell phone data to track them. We're not we're not implanting microchips to track people. This is very much like human to human, person to person, a public health nurse who's trying to navigate this moment of crisis. And I think that yes, it's not kind of this, it's not sort of the creepy sci-fi army that we're looking to implement. And actually that's then why it's so labor intensive, because it's not just some big giant computer database that's doing this. It is very human to human, and requires a lot of personal contact to make it work.
And I think we're in an environment where we're more sensitive to those issues. I mean, I think it's interesting to contrast it to the situation in South Korea. Obviously, they had a sort of a heads up about this in the sense that they were hit by MERS. And so they, had the political and public will to prepare. But part of that was, having a little bit of very central Bluetooth and GPS, privacy issues that I think, have helped them, of course, to manage the situation, but I think have raised a lot of privacy concerns in certain Western democracies who are taking a little bit more of a sensitive approach to this overall, which, I think is the appropriate way to go.
And you mentioned, you addressed this already, but people said, how are we going to protect privacy under this? And the folks that are doing this work under really strict HIPAA and privacy controls, and will continue to do so.
Absolutely.
We also got a question that, is it true that the governor has waived HIPAA rights if you get a COVID test? No, that's not true.
I am not aware of that.
No, it's not true.
That would be very surprising.
That is not true. That is not true. And I think the other thing that's just really important is that, as we move through this, if we are going to be able to do what we need to do in order to reopen, in order to recover, it is so important that the public trusts our public health officials, that the public trusts the people that are doing this work. And, I think there's a recognition amongst policymakers and, our teams on the ground that anything that we do to break the public's trust will set us back, months and years. And so we are ensuring that everything that is being done that ensures privacy, that that we don't take steps that are going to make the public not trust us and set us back. So that's all I'll say on that. Okay. Now I want to switch gears. Oh my gosh, we only have like 10 minutes. I think this has been a very good conversation, but before we wrap it up, I want to touch on serology and antibody testing, which we mentioned a little bit at the top. And I think everybody's been reading a lot about this in newspapers and articles. So I'm going to start with Quest. Can you just give us kind of top line, like what are these serology and antibody tests? How do they work?
Absolutely. So COVID-19 antibody tests are, as the name suggests, tests that look for antibodies to COVID-19. They are blood-based tests, so just like a glucose test or a lipid test or a chemistry panel. It's a blood sample that the patient submits, sends to the lab, and we do testing on that blood sample to identify if the patient has antibodies to COVID-19. Now, for folks who aren't aware of what an antibody might be, they're essentially substances or proteins that the body produces to fight off infection or foreign invaders. So if we do identify a COVID-19 antibody in a patient, that suggests or that tells us that the patient had previously been exposed to and infected by COVID-19. There are different flavors of antibodies. There's what we call IgM, IgA, IgG antibodies. Probably the best studied antibody and the most widely available test for COVID-19 antibody testing right now is for IgG antibodies to COVID-19. And the presence of IgG antibodies to COVID-19 means, if a patient tests positive, that essentially means that the patient had been exposed to COVID-19, had an infection, asymptomatic or not. And beyond that, we don't know. There's some suggestion that the presence of IgG antibodies can confer immunity to future infection. That's certainly the case with, say, chickenpox. Once you get chickenpox once, you tend not to get it again, and that's because you develop these IgG antibodies to chickenpox that prevent reinfection. But then on the flip side, we also produce antibodies to HIV, but we know that those antibodies are not very effective. And so we know that IgG antibodies to COVID-19 probably fall somewhere in that spectrum, but we don't know yet.
So, because I think we've all seen, on like social media, there'll be celebrities who say, "Oh, I tested, I have the COVID antibodies, like I'm back in action." And I think what you're saying is that's not actually true.
That's right.
Well, what I'm saying is, we don't know for sure if it's true yet. We believe so. We have evidence to suggest that it does confer immunity, but the question, we're not 100% sure. And if it does indeed confer immunity, we don't know how long it confers immunity for.
Okay. So I think on this subject, it sounds like there's so much that not just that, that I don't understand or kind of the public doesn't understand. There's still so much that scientists and experts don't understand, and that we're actually learning right now in real time. And the only way that we're going to really get to those answers are with really well-designed studies. And I know UCI is working actually on a couple of those with the county. Can you, tell us a little bit about what you're doing and what we're hoping to learn as we implement some of these studies?
Right. So I think one of the fortunate things living in the time that we do is that, we've never learned about a virus faster than we have about COVID-19 and the virus that causes COVID-19. And so it is really quite remarkable how quickly we are learning and have the opportunity to kind of share that information very much more so in real time than we ever have. I think at UCI, there's a lot of, really exciting things going on in terms of the research and the discovery process about the disease, all the way from clinical trials and being one of the initial participants in the now EUA-approved remdesivir trial and the second phase of that, the convalescent plasma trials and being one of the initial sites for the national studies on those. Obviously, some of the basic researchers have some very interesting and innovative testing platforms, as well as basic science discovery platforms to look at the virus in real time. So there's a whole host of different activities going on that, of course, as a laboratory, we're able to then provide the specimens that the researchers can do the studies on as well. And so that provides an important resource for the discovery as we learn things, as quickly as we can. to try to combat this disease. And it's really challenging, right? It's a brand new virus. So we have a lot of experience from other viruses, but we can't say for sure until we actually test it and find the evidence for it. And so, but it is also exciting to be at a time where this is happening faster than it ever has before.
Mm-hmm. Right. So we're testing and learning every day. And I think what's really fascinating and incredible to me is seeing that this isn't just happening in one laboratory in Orange County. I mean, there are tests, there are tests, there are studies that are happening all over the world, and we are learning from one another, and the scientific community is learning from one another, as you said, kind of faster than we ever have been able to before. Which is pretty phenomenal.
Yeah, which is exactly right. You know, people often look at the downsides of the things like the internet as well, but boy, it is truly facilitating the exchange of information across the world in real time, which is really one of the great benefits of the era we are in.
And I had one question asking, so what COVID-19 serology test is offered by Quest?
We currently offer the IgG antibody testing.
Okay. And I think
same at UCI.
And that's also at UCI. Okay. And I think, but what I've heard, I think from you now, and then also, from public health experts, is that right now there's not a lot of actionability from an individual taking a serology test. That we still need to learn a lot before we know, does having an antibody mean you're immune? How long does it confer immunity? And how do we use that to, get people back to work in the safest and most efficient way?
Right.
So how far away are we from kind of getting some of those answers and having those actionable insights?
So I think we're I would be surprised if we don't have some answers about whether the antibodies mean immunity in the next few months. People are studying this so quickly. We also have the world experience, the folks in China and in Europe and some of the other places that are studying this as well, to learn about the immunity question. Does infection confer some immunity? That part, I think we will have answers to within a few months. The next phase of antibody, of course, is whether the antibody test will be important to ask the question, is the vaccines that we're developing, are they effective? Right?
Okay.
And so, of course, that will be, a big part of where antibody testing will be hugely important for us to get back to normal.
Right.
And I also want to just add that, apart from the individual benefit of serology testing, there's also a societal benefit to antibody testing. And what I mean from that is, going back to Dr. Monuki's comment about the numerator-denominator problem, where we know what the numerator is, but we don't necessarily know what the denominator is. And part of the issue with that is that folks who were symptomatic but didn't come to medical attention, or a significant number of folks who had asymptomatic carriage. And so if we do widespread serology testing, we'll have a better idea of the actual prevalence of the disease. And based off of the actual prevalence of the disease, we can better tailor our public health response to how we need to improve social distancing and things of that sort.
Understood. Well, we've kind of come to the end of our hour, and we have a bunch of questions still in the queue. If we weren't able to answer the questions that came in online, my team will be cycling back with you directly so that we can get your questions answered. And if you've emailed us a question or you want to email us a question, we can also respond directly to that. Thank you to all of our participants for joining us tonight and sharing your perspective on this really critical priority. It's a critical priority for California, and it's a critical priority for Orange County. We need to have sufficient testing capacity and a robust testing infrastructure in order to be able to swiftly identify outbreaks and in order to sufficiently and quickly contain them. So was pleased to hear tonight that we have made some really tremendous progress. I mean, there's been a Herculean effort all across the state and here in the county to ramp up capacity over the course of the past 2 months. We have a lot of work that we still need to do, and a lot of lessons that we still need to learn. And so we will continue to keep you informed as capacity grows and as our understanding of COVID-19 deepens as well. So thank you again for joining us this evening, and look forward to seeing you soon.
Thank you. It's truly a pleasure.
Okay, and I think we're all done. Okay, thank you. Thank you so much. That was super informative for me, and I hope for folks at home too.
I'm glad. Great.
All right. Thanks for everything. Yeah. Thanks for everything, that you and your teams are doing to really move the needle on this.
And you too.
Appreciate that.
All right. Be well.